Well, welcome everybody. We're really stoked here to have, I think, over 160 participants today participating in this webinar on worksite safety and this certainly COVID-19 crisis that we are currently living in. So we've got a really good panel today. We've kind of scheduled about 90 minutes for this event to happen. Today's session is being brought to you by the expertise of the Saskatchewan Construction Safety Association in partnership with the Saskatoon and Region Home Builders Association and the Regina Region Home Builders Association. With us from the SCSA is Loy Levesque, Christine Reynolds, and Bill Kressel. And in a few moments, we're going to be having Christina do a bit of a presentation today on kind of getting the basics around this subject and then opening it up for question and answers. With us also today is Nick Sackville from the Saskatoon and Region Home Builders Association. Nick and I will be watching the question and answers come in, and after Christina's presentation is concluded, we'll be asking your questions and answers, questions that you get to. Now, the way you ask a question is really simple. On the bottom of your Zoom tab there is a question and answer tab. Just click onto that and ask your questions through there. We won't be using the chat section, just the question and answer section for that. And then at the end of the broadcast, we're going to have a couple of other pieces of information here as well. But just before I turn the mic over here to Christina to get started, I just got to share a little bit of a personal story from yesterday that I think for me described a bit of the state of the nation out there. We were very fortunate and we worked very hard as an industry and as associations to ensure with the provincial government that the residential construction sector was deemed an allowable business to be open during this COVID-19 crisis. And so, between different organizations like the SCSA, like the RHBA and the Saskatoon Home Builders Association, we've put a lot of information out there for you to be able to take advantage of. But, yesterday I just came off of my travel quarantine period. So yesterday was my first day that I could leave the house in 14 days, and I really needed to get out of the house. So I jumped in my car, took a drive through several of the subdivisions in Regina here. Again, being very careful not to leave my car and do proper social distancing during this time. And, I could really see, the challenges that were out there. Out of about half the construction sites that I saw, granted, there's not a lot of them because, again, activity has been slow. But out of them, about half of them, just visibly, probably were not meeting the expectation around COVID-19 and safety, and certainly not meeting the government's expectation around this as well. And this is one of those items where we are really all in this together. The issue won't be that OH&S closes down Worksite or not. It will be whether the industry as a whole gets to maintain its allowable business status through this period of time. And that is why it's so crucial that we all take this very seriously and make the adjustments to our business to allow us to continue to operate, because the alternative to this will be significantly worse. So may have some additional comments later on, but on that note, I am going to turn it over to Christina here to lead us through the next part of the webinar.
All right, thank you, Stu. I'm just going to share a screen here. All right. So good morning, everybody. My name is Christina. I'm with the SCSA an advisor. I've been here for about a year. I'm going to talk to you guys today about COVID-19 and the home building sector and residential. So we are focusing on the topic of COVID and on-site safety in residential construction. What is COVID-19? What can we do to ensure our health and safety while working during this time? What can be done if physical distancing is not plausible? What are we dealing with is the first step. As time progresses, more information becomes available and we can adjust our ways of dealing with this virus. So what is COVID-19? COVID-19 has been declared a global pandemic and a public health emergency in Saskatchewan. It is a virus that can cause respiratory illness, which can lead to hospitalization with the possibility of death. The effects of COVID-19 are expected to be much more severe than seasonal influenza because most people will not have any immunity to the virus. Seniors and people with underlying health issues, including heart disease, diabetes, and lung disease, are at a higher risk, but young and healthy people are also at risk. So, symptoms. So common symptoms include fever, tiredness, cough, shortness of breath, and breathing difficulties. Other symptoms include aches and pains, sore throat, loss of taste and smell, and on rare occasion, people will report diarrhea, nausea, or a runny nose. People with mild symptoms who are otherwise healthy should self-isolate. If symptoms feel worse than a standard cold, contact your medical provider or a COVID-19 information line such as the Health Line 811 for advice on testing and referral. With most respiratory illness, most people with COVID-19 illness will recover on their own. Currently, there is no approved vaccine that protects against COVID-19, nor is there a specific treatment yet. Also to note, there are also people that are asymptomatic, which means they are not showing any symptoms. However, as health authorities learn more about this virus, more information is coming out. Some individuals that have been diagnosed positive with COVID-19 that are asymptomatic are showing different symptoms, such as losing their sense of smell and taste. At this point, it's very important to self-monitor. Use the SaskHealth self-assessment tool and keep up to date and follow the government requirements that are set out. Next is needing to know how it spreads. When it comes to your workplace, conducting a risk assessment before you start work can identify different levels of exposure to your site so you can put controls in place. But how does it spread? Right now, there are 3 known routes of transmission for COVID-19. This includes droplet, close contact, and surface contact. So breathing in droplets in the air, if somebody coughs or sneezes, they do generate droplets, which are airborne for at least a short period of time, but do not float in the air and generally fall to the ground within 1 to 2 meters. Anybody who is near the individual may risk breathing in these droplets, so physical distancing, maintaining 2 meters of distance from other people at all times will reduce the risk of this occurring. Close contact refers to physical contact with another person. For example, shaking hands, hugging. When people cough or sneeze, droplets may deposit onto their skin or clothing, especially if they cough or sneeze into their hands. People who are carriers of COVID-19 may transfer the virus from their hands or clothing to other close contact. Surface contact. Surfaces can become contaminated when droplets carrying COVID-19 deposit on them or when they are touched by a person who is infected. Surface contact involves a worker touching a contaminated object and then touching their eyes, nose, or mouth. Surface contact is important to consider because while it's not yet known exactly how long COVID-19 lives on surfaces, preliminary evidence suggests it can live on objects and surfaces from a few hours to several days. This may vary under different conditions, such as the type of surface, temperature, or the humidity of the environment. It is important to know how it spreads to create a plan and procedures to conduct your work in the safest way possible. These first 2 steps are part of the process for creating an exposure control plan. If you're still working at this time, exposure plan to ensure that all areas through on how to complete a task as safe as possible. So the occupational health and safety regulations under section 85 discusses exposure control plans and who should be involved and what content needs to be in place. Granted, with this being still new and an unknown virus, your exposure plan will have to be updated as new information becomes available. Some items the exposure plan must include, must be in writing. It must identify any workers at the place of employment who may be exposed, identify categories of the tasks and procedures that may put workers at risk of exposure, describe the ways in which an infectious material or organism can enter the body of a worker and the risks associated with that entry, and describe infection control measures to be used. To help create your exposure plan, you will need to conduct a risk assessment in order to determine workplace exposures. This process will determine the level and risk of workplace exposure to COVID-19 for your workers in each area of work. The first example is broken down into levels of exposure so you can prioritize and figure out best controls. On this next slide, here is an example of a risk assessment that can be used for a pre-job use for overall start to finish tasks to help with planning out the project timelines so that different trades can be spread out effectively as well. It can be used daily for changing conditions. When it comes to controls, the regulation requires employers to implement infectious disease controls in the following order of preference. So first choice will be engineering controls, second choice, administrative controls, and third choice will be personal protective equipment. From there, you can establish what precautions can be taken on site. Having adequate amount of wash stations or alcohol-based sanitizer readily available, avoid touching your eyes, nose, and mouth with unwashed hands or gloves. Cough and sneeze into the crease of your elbow or tissue. Do not share food, drinks, cigarettes, or personal hand tools. Make sure that hands are washed thoroughly or disinfected with hand sanitizer as soon as possible after gloves are removed. You can also implement a more frequent cleaning sanitization schedule and procedure for your safety for your site office trailers, work and personal vehicles by using a surface cleaning checklist specific to your job site. This will help alleviate any missed items, areas, and helps document and keep the cleaning schedule on track. To get into more detail for working on residential sites, there are some tips that can help everyone be safe. So figure out trades on site. Scheduling will be an asset to alleviate any worker congestion or issues with proper distancing. Timelines for different installations should be analyzed and broken down to allocate workers to specific housing structures, lengthen completion times due to reduction of workers, delivery schedules, hoisting operations, working at heights operations. Having a planned out schedule for when jobs need to be done by will be crucial to your success on keeping the workers safe with the proper distancing and timing. As well, communication is crucial on this part. You can also know the total number of people on site and where they are assigned to work. Have start times, breaks, lunches staggered to help avoid close contact. Generally, residential sites do not have access to lunch rooms or job trailers, so ensure workers are taking breaks in isolated areas or in their own vehicles. Also have workers come to work in their own vehicles as well. Ensure 2-meter distancing. Meetings outside and spaced out 6 feet between personnel, or if you can use video phone systems for meetings, then do so. Any deliveries to site, you can either have the driver remain in their cab and unload the items for them, or the delivery driver can unload the items at a specific location so there is no close proximities breached. Visitors to site, such as inspectors, have them walk around and complete inspections on their own. Once done, they can go over the findings over phone call, video chat in a separate vehicle or through proper distancing. If signatures are needed, you can come up with a procedure where documents can be signed electronically to avoid surface exposure. When dealing with homeowners, whether it's warranty work, renovations, or general fixing and installations, See if it can be held off if it's not crucial to be completed right away. If you do need to conduct work at an occupied residential location, conduct a thorough phone call questionnaire before scheduling, determining the hazards and exposures prior to accessing the site, verification of health of homeowners, where they will be during the work completion, a PPE and hand sanitizer readily available, detailed cleanup procedures, payment and processing procedures as well. Ensure that work clothes are being washed, cleaned daily, or are isolated until they can be washed, and have cleaned work clothes daily to avoid spreading to other residential sites. You do health verifications, use the Government of Saskatchewan COVID-19 self-assessment tool questions to verify that workers and visitors are not feeling sick, and so they are aware of what the symptoms are so they can self-monitor. You can also request that any visitors to call and schedule in advance for a specific time before showing up to any site. You can limit the number of persons in orientations. You can utilize video orientations when possible. As part of the verbal orientation, you can discuss physical distancing of 2 meters, hygiene and location of hand washing and hand sanitizing locations, what the company is doing at that site, promote health and safety of the workplace, and remind them that their health and everyone's health is important. The importance of reporting to the supervisors if you are not feeling unwell and are leaving sites. You can limit the number of workers or restrict who is allowed to enter office trailers or enclosed tool trailers. You can place contact information, phone numbers outside on the doors. You can avoid sharing tools or equipment. If you have to share equipment, clean and disinfect points of contact on the equipment. For final finishing stages and handover stage, you avoid touching surfaces you do not need to. You can wear gloves and respirators, disposable boot covers, wear clean work clothes or disposable coveralls when entering a new site at finishing stages to avoid contact surface spreading, and then disinfect work area once completed. So there may be times when physical distancing is not possible. There are added measures that can be done in those types of situations. So plan job tasks to limit the amount of time workers need to be closer together than 6 feet. Develop a safe job procedure for tasks that require workers to be closer together than 6 feet. When workers need to work in close proximity to each other, they should wear appropriate PPE, such as gloves, safety glasses, fitted N95 respirator or P100 respirator, and disposable coveralls or clean clothes. The workers need to distance themselves from their coworkers if they do need to sneeze or cough. This should be done into their elbow or tissue. Tissue should be disposed of immediately into proper waste receptacles. The worker will need to thoroughly wash or sanitize their hands prior to resuming work. When the task is complete, employees should thoroughly wash or sanitize their hands, and then disposable PPE such as gloves, Tyvek coveralls, and disposable respirators should be disposed of properly in a waste receptacle. Any reusable items such as safety glasses, hard hats should be thoroughly washed. Lastly, keep yourself updated on new information regarding COVID-19. The more we know, the more we can put the best controls in place to prevent. Okay, so well, that wraps up the presentation. Make sure to check out our website for up-to-date information regarding COVID-19, as well as for information that was discussed today. The SCSA team has been working hard on creating useful documentation, as well as having links and resources readily available for you to help and navigate during this difficult time. If you do need to contact an advisor with any questions or concerns, our emails are listed on our website under our contact tab and listed in the Regina and Saskatoon office locations. And that wraps it up. Thank you. Back to you, Stu.
Awesome, Christina. That was fabulous. Some great information. Please do start sending your questions in. We've only got a couple of so far. One of the comments, or a couple comments we did get in during the presentation, there was a little bit of, for some people, a little bit of challenges with, the presentation cutting in and out a little bit. So just want to make note that the webinar at some point here will be making available online as well, so you can capture that again. Plus again, at the as Christine mentioned, at the SCSA website, also at the Saskatoon and Region Home Builders Association and the Regina and Region Home Builders Association. We all have COVID-19 resource centers on our web sites, and so lots of information you can access there. A couple people also had sent in some additional resources through the chat line. So after the webinar, we'll have a look at those and see if any of those are applicable to add to our resource centers as well. So a couple of questions that have come in here, and they're starting to come in quite quickly. Where am I able to buy masks for my employees to wear? Well, that's a tough one. Anybody have any thoughts on that one on the panel?
Well, I have some thoughts. Unfortunately, they aren't really helpful thoughts at this point. This is a problem everyone is facing right at the moment. We are working very hard to find a vendor and get these items available to everybody. Right at this moment, I don't have any information to share with you. We will be posting that information as soon as we can get our hands on it. But we are working very hard in the background to try and source those materials for you. Stu, you're muted.
Right. Related to that question, are there any video or proper procedures to put on or take off masks?
Oh, okay, I will talk to this one as well. I do know you're still able to access fit testing. I don't know the exact locations right now. You'd have to call around and find that. But that's an excellent question, and my team can look into that, and we'll put something together just as a resource. But as far as the N95 masks go, you still do need to be fit tested, and there are still facilities that can provide that service. So again, my team will get working on a procedure for you, and we should have that up in the next couple of days.
Next question here, and again, a very tough question, I think, for anybody to truly know the answer to this one, but how long will we have to practice social distancing?
I think with this question, and even it could relate a little bit to the prior questions here, a lot of this is still unknown, and we're hearing different and conflicting messages depending on who you're listening to. So we just encourage people to keep listening to what would be considered legitimate news sources, whether it be government websites or the World Health Organizations. If you start listening and looking at the news out there and listening to it too much, you start hearing a lot of rumors and hearsay. So you want to be sure that you're taking your information from a reputable and a reliable resource. Getting back to that question or those questions when it comes to the respirators too, Tina, when she did her presentation, spoke about some of the precautions that you can take to minimize risks. In most situations, the masks or the respirators wouldn't be deemed necessary based on the information that we have right now when it comes to COVID as far as the transmission of the virus. So if you're looking at some of the other precautions and preventative measures, they may be at this point more beneficial than relying on the masks and the respirators.
Another question that's come in here. I am a small home builder. We only build a couple of homes a year. It is challenging, the delays, and to control my work site when subtrades are just showing up unexpectedly. I want to make sure my site is safe, but I also can't afford to send them away to not get the work done. Anybody have any thoughts on that?
Well, I think with this one here, communication is really important. There was a webinar or seminar that we had access to yesterday where they were talking about commercial and industrial sites. I think one of the advantages that we have when it comes to residential and home building is typically we have less people on site, so it may be of some advantage to us to be able to control and coordinate those sites a little bit better than the larger sites. That being said, communication at this point is key, and this really isn't a time or the place where we can take shortcuts. So if people such as the sub-trades or subcontractors come on site, we really need to be careful with that coordination, and this isn't the time to be taking any sort of shortcuts and giving us, you know, an excuse to be able to bypass some of the recommendations that are coming out at this point. So we really got to pay particular attention to that. And this situation is definitely producing a lot of challenges here and making us take a look at how we operate our businesses, how we do business. But really important, not just from our own personal level or a company level, a societal level, as to how we're contributing to this and trying to beat this situation.
Great. Question from what sounds like a trade partner. They're facing challenges related to getting workers to sites because they have typically in the past had multiple people in one vehicle working, heading to a work site. Do they need to have each worker show up in separate vehicles?
Hi, I can speak to this one. Social distancing is a law. You cannot be 6 feet away from each other in a vehicle. So yes, I know it's inconvenient, but everyone has to drive in their own vehicle. The only way you could perhaps have more than one in a vehicle is if both of you are wearing full personal protective equipment, and that really isn't reasonable for most people while driving in a vehicle. So yes, instruct everyone to drive themselves to site.
Great. Next question. Can OH&S shut down my work site for too many trades on the site?
I'll speak to that one as well. Yes, they can. With Premier Mo's directives, they have been empowered to enforce the rules that he has put in place regarding COVID-19. So OH&S has full authority to shut down work or issue tickets for not abiding by the social distancing or personal protective equipment rules at this time.
All right. We've got really, oh, here's a new one that just came in. In your opinion, would you recommend having a portable bathroom on site, even with just sanitizers available? Would you recommend only having a washroom on site if you only have access to soap and water? So I guess the question is what do you really need on site to be available on a residential construction site?
I can speak to that one as well. Going by all the information that has been provided through the health authority, soap and water are the best methods to kill the virus on your hands. The soap breaks down the protective barrier around the virus, thus making the virus basically die. Hand sanitizer is a good option if you don't have that running water, but I would still prefer washing hands thoroughly with soap and water and wiping them on paper towels, not towels that other people can reuse. As far as the washroom situation, that's a tough one. Everyone would have to just wipe down, sanitize the parts that they have touched, like the door handle and that type of thing, to make sure that they are not at risk while using those facilities.
I just have to add to that, Stu, if I could. I was thinking about this too, with a majority of the businesses, especially the public ones, not being available. A lot of times tradespeople were using their local restaurants or coffee shops to use the bathroom. So that being said, there would be a lot less washrooms available at this point. So again, there's the importance of having your workers have access to washroom facilities, or whether that be using a portable washroom, may be able, or the best the methods to meet that need at this point.
How many workers can be on a site at one time?
I'll add to that. So when it comes to workers on site, it all depends on how much space you have to work with as well. You want to be able to have that proper physical distancing between workers. So it is all based on what is all needing to be done and your projects at hand.
Next question. With the passing around and filling of site of documentation, i.e. risk assessment forms, site orientation forms, etc., can the virus stay on the paperwork, or is there something recommended as a precaution to not pass the virus through paperwork?
I can speak to this one. Yes, the virus does live on paper for a short period of time. The bigger concern is it would live on a pen for a longer period of time. And typically what happens is you pass the paper and the pen around and everybody signs. There are different methods we can use to keep track of everyone rather than physically signing that document. It could be email somebody, and those will be recorded as your attendance at those meetings or your theoretical sign off on those documents. Text messaging, of course, works well. Any online programs for document retention, that sort of thing, you can usually sign through there as well. But yes, please do not get in the habit of passing a paper and a pen around for people to physically sign. One person could also be deemed as the note keeper, if you will, and they could make a record of everybody on site at that time.
Next question. Should employees who smoke be prohibited from smoking on site as they are putting their hands to their face, or is it their right?
I don't think we can prohibit people from smoking. I would enforce that they need to use the proper precautions when they're going to be doing this. So washing their hands thoroughly before going for a cigarette break, that type of thing. Making sure that their cigarette package, for example, is tucked away so it doesn't get contaminated itself. So I don't think that you can restrict people from doing that, but I would definitely put some hygiene practices into place surrounding that activity.
We also got a little bit of a plug here for one of the participants, but might be a good opportunity. If you go to I'm going to just spell it out, saluspro.app. They are currently offering a free subscription to online virtual storing of safety documents, which can eliminate the use of pen and paper. So a bit of a plug for somebody in there. Another question, again, sorry, go ahead.
Sorry, would you mind just typing that into the chat feature, that address, so people can write it down if they choose?
Oh, it's pronounced Salus Pro. I will have to do that later because I hit the dismiss button on this already as I move through the question. So I'll have to figure out how to go back, but we can probably find that and get it posted on our sites at a later point after the webinar. I
Stu,
think
if I
one
could
of
just
the
add to that one too, I think we're seeing more and more companies and individuals using electronic means of whether it be safety documentation or other documentation. So this just kind of gives us that extra push to get that going. And a lot of companies are finding it quite beneficial and a good way of keeping track of their documentation. So this is a time here where we really need to rethink a lot of the ways of which we have been doing business, and gives us that opportunity to try some things out. Even these webinars that we're taking part in, or panel discussions, the amount of companies and people that are taking part in these would have never taken off to the extent that they have in such short order because of what's going on right now. So, you know, there's opportunities that are coming out of this as well, and it may change the way that we do business.
Yeah, some real truth to that. We're certainly seeing that with the city of Regina as it's shifted completely to permanent inspections being done completely digitally. So yes, you know, there's always, as tragic as it is, there's always opportunity in a crisis. The group from Salus Pro, they did re-put that in here, so we can now get this this posted again here. Again, as soon as I figure out how to do that. Next question would be, would using a face shield be a good practice if there are no masks available and you have to be close to your coworkers? And I guess maybe another way to just add to that question from my perspective is, there are things on the construction site that just simply require a couple people to do. And so as an example, you know, it takes two people to hold up a window to put in a house, and so you can't do everything in that project being the 2 meters apart. How do businesses on the work site address that?
Okay, again, the easy answer to that is no. A face shield is not going to protect you. That may protect any droplets of physically landing on you, but it is in the air, as Christina mentioned during her presentation. So that's why a fit tested mask is required. And as soon as I get information on suppliers, it will be shared far and wide, so you guys know where to get a hold of that.
Kind of another question similar to one that's, I think we've kind of quasi-answered this one already, but just to reiterate it, the question did come in, how to go about crews driving out of town jobs together?
I'm sorry, Stu, you kind of broke up on me. Was the question, how do people travel to out of town sites together?
Right.
They don't. They drive in their own vehicle.
That's very simple and straightforward. And unfortunately, it adds extra cost. It adds extra challenges. And in some ways, maybe even creates other safety issues related to it. But as you said earlier, it is the law now during this period of time. And the ability to continue to build on these work sites, we really do have to think of those not as a right, but really as a privilege right now as allowable businesses. So things are not going to be as efficient and as cost effective during this time as they were previous to the virus outbreak. Next question. Can contracts for work be broken due to the time taken because of COVID-19? Would the Saskatchewan Construction Association backup contractors. Again, it's a tough question because it's more of a contractual question within your agreements with your customers, which may be, business to business, might be business to consumer. Probably the first place to start. I mean, it needs a legal answer to that, but probably the first place to start is a good discussion with your customers to manage expectations of going forward. The reality is that safety in this environment kind of trumps all other factors. What type of precautions can be taken for the service industry? How can we protect ourselves when we enter customer homes and then not carry it to the next customer's home or our own? How do we abide by the government's social distancing with relations to this? And I guess this would be, one that might also impact, renovators within the marketplace as well.
Okay, I'll speak to that one. Tina kind of covered some of this in her presentation, is have a change of clothes with you or wear something like a disposable suit that you can take off before getting back in your vehicle and heading to the next service call. So that way you're making sure you aren't carrying the virus from one home to another in that case. We have developed a very short questionnaire that you could have homeowners or clients fill out, just checking to make sure they haven't experienced any of those symptoms or anyone in their home before you go into their home to do that work. There was a situation we heard about last week where someone went into the home. They did tell the homeowner, I need at least 6 feet around me, so don't come near me. And that was all fine and good. Work got completed. And at the end, the homeowner said, oh, I'm so glad you got here so quickly. We just got back from Mexico, and I'm really glad I could get this taken care of so quickly. So I don't think homeowners are trying to deceive us, but many people are just not aware of what the hazards are. So a very quick health questionnaire to have them fill out prior to going onto their site can help to refocus them if they haven't even thought about it before, and have them sign off on it prior to entering their site. It is going to take a little bit longer when you're on their site because you will need to stop and clean the work area that you're going to be working in. You can wear disposable gloves if you like, but the hazard with that is if you do end up touching your face, gloves will hold the virus longer than your own skin, and they're harder to wash. And a lot of people taking gloves off improperly can also transfer that virus. So I would recommend scheduling a few extra minutes. Go in, have your soap and water with you, wipe down the area that you're going to be working, continue with your work, make sure the homeowner knows they need to stay far away from you for that period of time you're in their home. And then when you leave, again, wash your hands thoroughly when you exit the house, take off your disposable suit and your gloves. If you take your gloves off, then wash your hands thoroughly again before getting in your vehicle. That's the best you can do to reduce the risk of taking a virus from one home onto another.
Great. Some good advice, Loy. Does the SCA have the ability to assist companies in purchasing hand sanitizer? And I guess that kind of goes back to the question earlier about, the tools that the industry need are also the tools that healthcare professionals need, and other people in society need through this crisis. And there is challenges and shortages in accessing these items.
We have found, we worked with Merit Contractors to source some hand sanitizer, and we have located 2 distilleries that do have some available. I can put that in the chat feature here soon so you know who they are, and you can take care of contacting them yourself. I know several distilleries are ramping up and will have product available for everybody very soon. But you can check our website, and I will post the 2 that I know of currently in the chat feature if you guys want to check that link.
Another one, again, another question that's come in, and I think it's been answered, but just again, to really make this point really, really clear, the question kind of came in more suggesting that at yesterday's presentation, driving in separate vehicles was a recommendation. Today, it's a requirement. Just for clarity here, it's not a recommendation. Driving in separate vehicles is absolutely a requirement. So just want to kind of clarify that once again. And if I got that correct? Yeah. Okay. Somebody also mentioned here there are local distilleries currently producing and manufacturing right now, such as the amidst distilleries out of Alberta. A question came back, where can I access a questionnaire for homeowners to complete? I guess that's going back to your last comment there. Do you guys have anything available that might work for people?
Yes, we do. We actually have many resources that we have developed, and we're adding to it frequently on the SCSA website. So scsaonline.ca, resources, COVID-19. Lots of good stuff there, and I'll post that link as well in a moment.
Awesome. That's great. And hey, and going back to Minhas Distilleries, I had pronounced that wrong. It is Minhas Distilleries. So I got a correction on you here there as well. So thank you for that, sending that in. I am now kind of in a bit of a hold pattern here, just making sure there's no more questions that have come in at this moment. Here's one. If it is a family business that sleeps under the same roof, are they still not allowed to drive together? So another driving question.
Sorry, I was posting that link to our website.
Oh, there we go.
Yeah, the government has deemed if you live in the same household, you do not need to maintain social distancing. So in that regard, it would be fine to drive to site together.
Great. And I'm just seeing if there's any more coming in here.
Stu, I wouldn't mind just adding a little bit to that questionnaire that we had referenced to. Sometimes people have a tendency to just maybe ask and get kind of a verbal contract or a verbal agreement with people. And I guess there's nothing wrong with doing that as well, but when it comes to actually ensuring your safety and going over those questions, when it comes to the questionnaires, if you're entering someone else's household, I think it does definitely have more weight or meat to it, I guess, if you were to provide that documentation, and actually where they go through the questions themselves and then have a sign off on it. We talk often about the importance of documentation. I think this is just another time or a way that you can have some documentation where it's not just a verbal, this is what they told me after sort of thing.
Okay, no, good to hear. Again, the last question I have up here right now, again, I think we've already answered it, but again, just that clarification. Three of us live together. Do we all need to take separate vehicles to the work site? So again, if you're all under the same household, I guess the government has said that is all right. Other than that, no, you need to take separate vehicles. Again, I've got that correct. New question coming in. With so much industry related information, what is the suggested link site that has the best practices checklist, ongoing updates of mandates, and printable articles that can be downloaded? You know, I'll kind of quasi again answer that again, and then maybe you can chime in. I know the Saskatoon and Region Home Builders Association and the Regina and Region Home Builders Association, we are sending out to our members a couple times a week updates on the latest information about government programs, the safety information, et cetera, et cetera. We also have that information all listed in a resource section on our websites. But also, I think anything related to the safety side, again, the SCSA has a lot of resources, and probably, you know, you are the best experts in this area. And maybe, so again, that would be an important resource for everybody to pay attention to. And maybe you could just take a moment, Loy, and just talk again about some of the upcoming features that you have coming up. I think there's a session tomorrow, and about your advisors, their availability for questions as well.
Okay, thank you, Stu. Yes, we have a lot of resources posted to our website, as many places do. I really want to stress the importance of following the World Health Organization, the provincial government sites. Take your truth from there, and try as best as you can not to take Facebook truth for what it is. You really do need to make sure you're up to date with actual factual information, and that will come from those organizations. We do have links on our website. I did post where that can be found in the chat feature if you want to check that out. It turns out that this meeting was only scheduled for 1 hour, so we only have a few minutes left. I just wanted to let everybody know the SCSA is still in business. We're all working from home, but we are on top of this and ready to respond and help you guys as much as we possibly can. We are going to be starting Ask an Advisor, 1 hour long webinar sessions, much like this, every Tuesday and Thursday from 9 to 10 a.m. You can just log on, the link will be on our website, and it'll also go out through social media and various platforms as well. I would encourage you all to connect to those sessions so we can keep the conversation going as we're all learning about this as we go. It's the sharing of information, the sharing of different issues you may be encountering on site. It's looking at those, and the more people that can look at it, the more we can come up with good, solid safety measures to keep everybody safe. So that will be kicking off tomorrow from 9 to 10. And yes, make sure you're utilizing your resources. Saskatoon and Region Home Builders, Regina Home Builders, the SCA, WorkSafe has a bunch of information posted there as well. Use those resources and get the answers you need.
That's some great information. We'll squeeze in just a couple of more questions right to the end and take full advantage of that. One question came in. I missed the first half of this. Where can I view a recording? So I think we'll be having this posted, I imagine, on the SCSA site at some point over the next day or so.
Yes, we will have the link posted to our website as soon as we can do that. I think it'll be later today.
Right. Okay. Excellent. And would that be, do you think, on YouTube as well?
I'll be honest, I am not a techie person, so I will have to check in with communications and I'll send that information out.
Okay, excellent. Are subcontractors solely responsible to have their protective equipment on a home builder site, or does the home builder have to make them available?
That's a very good question. I don't have a quick and easy answer for you. Typically, it's your direct employer that supplies your personal protective equipment. So I would be looking internally first at supplying that equipment. If you can't get your hands on it or you need help with that, that's when I would approach the home builder and ask if there's any help or resources they could provide to you to make that happen.
And I think that's a great answer. And I think just adding to that as well, I think what's really important to this time, both individually for personal protection, but also for the protection of ensuring our industry stays an allowable business. If you don't have the answer between you and the home builder to that question, the right answer is don't work. That's the right answer. Don't work in an unsafe environment. And today, at this moment in time, COVID-19 is a very significant safety violation. Looks like one last question. Is it mandatory for cities and towns to report when there has been a confirmed case? Where would I go to see which places have them? Really a question for the provincial government. To me, it appears like the provincial government is being very careful not to identify particular places where the virus is showing up, and asking all of us to just all take the steps that are in place, like washing hands and social distancing, et cetera, and mandatory self-isolation if we are feeling any type of symptoms remotely related to COVID-19. Would I be kind of correct in that, do you think? I'm making a bit of an assumption.
I think you're absolutely correct with that, Stu.
Yeah. Last question here, and then we'll call it a day. So is the prime contractor in charge of PPP for all subtrades, or do they look at their own PPE? Again, I think you've kind of answered that question, but again, just to reiterate that, and tell me if I've got this wrong, safety on a work site, there is always somebody who is the primary contractor who's responsible for the health and safety of that work site. Within that, the relationships between the subcontractors and the home builder, how that equipment gets handled may look different in every situation. But yes, ultimately the prime contractor, like any safety issue, is ultimately responsible for that work site. Would I kind of have that right?
I see Tina and Rick are leaving me for this one, so that's good. Thanks, guys. I think it goes back to what I just spoke about a few moments ago. Typically, it's still your direct employer that supplies your personal protective equipment. Right now, that is a bit of a challenge to get your hands on. So to make sure that work can still take place and move forward, as a prime contractor, support your contractors under you so they can come to work safely.
Great. Well, I think that takes us up to our hour. Hopefully I won't get cut off with some closing messages, but I want to thank Loy and Rick and Christina, and I'm missing somebody over at SCA there, Ed and Bill, for helping us pull this webinar together. Hopefully it was some good information and helpful for the participants to be more prepared to keep the work sites safe. Once again, you know, there are lots of resources out there between the SCA and the two home builder associations. Please take full advantage of those. And any other closing comments for you, Loy?
I would just say, if you're able, sign into our Zoom meeting we're going to have tomorrow as far as Ask an Advisor. We'll also have program services there to ask any core, C-core, HSA, NCSO type questions as well. So we are here to help you guys. Reach out, let us know what we can do to help you through this time.
Okay. Well, again, thank you very much for all your effort. Thank you, everyone, for participating in this. These three organizations are here for you to help you through this this crisis to the best of our ability. And please have a great Regina and Saskatchewan Day, but most importantly, please stay safe. Thank you.